Hey guys, and welcome back to the course. You're getting moving and you start feeling a lot of things, right? Exercise can be really uncomfortable, and we want you guys to have a system for thinking through this stuff, because the most important thing is that you stay consistent and you keep moving. So when you're feeling all these new sensations, you don't know what's good pain or bad pain, or this stuff's uncomfortable, right? So we want to give you a system to think through it. So when you're talking about something like pain, you're talking about moving well, you want to consult the experts. So we brought in an expert guest to help us out on this portion of the video. And we're talking about an expert. This is my beautiful wife, Dr. Taylor Andrews, Clinic Director of Lake Houston Physical Therapy here in Houston. You ready to talk about some pain, Taylor?
I'm real excited, yeah. We want to keep you guys on the right track. We want to keep you guys moving. And so a big thing is being able to decipher, when things are good to keep going, when do I need to pause and think through what's going on? Do I need to consult somebody, just kind of be able to know what the next steps are.
Yeah.
So that's what we hope to teach you guys today. And yeah, real excited to be here and walk you guys through it.
That's what I'm talking about. I know a lot of people are like nervous to start moving, right?
Right, yeah, for sure.
My lower back's tight, or my elbow bothers, my knee
Especially if you've
bothers
had an injury in the past.
Yeah.
Some people are afraid to re-injure that. And it's, we want to keep moving. We say motion is lotion. And so, and it's true, motion is lotion. And so whenever you stop is that's the worst thing that you can do. If there is something going on, we can always modify things. We can always keep moving, keep going along, but we can just modify things. So that's what we want to kind of walk you guys through today.
Yeah, so don't let anything stop you. There's always a next step. There's always something you can do about it, right?
Absolutely.
So let's walk through it. So you're starting exercise, you feel pain of some variety. Mm-hmm. The first step, what do we got to do?
We got to evaluate it.
Mm-hmm.
So the first question that I like to ask patients in the clinic is, where exactly is that pain coming from? And what I'm looking for there is, is it a pinpoint pain or is it over a big area? So, you're working out, let's say you're doing leg day and you're starting to have some pain. Well, is that pain coming from the whole thighs? That might be normal. Good chances that's just the normal fatigue setting in. That's good. We want to keep working through that. But if you're having pain that's pinpoint, I can point to that pain. I'm saying my pain is right at the bottom of my knee, or my pain is right in my calf. Then something might be going on there. So that's where we want to be able to say, is it pinpoint pain or kind of diffused big area?
Over the whole area.
Over the whole area. If that's the case, it's probably just that whole muscle fatigue setting in, which is good. That's what we're here to work on.
And sometimes you might say, my whole leg hurts. And you're like, well, it's soreness or tightness. And
right.
No, I felt soreness. This is different than that. There's levels to it, right?
Right. There's levels to soreness.
Yeah.
Yeah. There's levels to fatigue, levels to soreness.
Yeah. And sometimes when you hit that new level, it might be really uncomfortable.
Yeah.
But just kind of let it have time and it'll get better, right?
Yep, exactly. So what we're looking for is if it's pinpoint pain, because if it's pinpoint pain, then there's something more likely than not, there's something to dive into there that we can make modifications for to help lessen that pinpoint pain.
Perfect. So we identified where it's at, right?
Mm-hmm.
It's either pinpoint or it's an area. Either way, something we can work on, right?
Yeah.
So the next step.
So we're looking at, can you describe the pain to me? So whenever I have patients come in through the clinic, a big red flag for me that I know that they're in the right place, they're seeing an expert, is if they're describing that they're having numbness or tingling. To me, numbness or tingling a lot of times can indicate that there's either some nerve issues going on that we want to address, or there might be some kind of vascular issues going on. Maybe there's not proper blood supply being brought to an area. So numbness or tingling are real big things that if you're feeling that, then it sounds like you just need to go straight to a physician, straight to a physical therapist, a chiropractor, someone a little higher up the chain. Mm-hmm. So numbness, tingling, just jump straight.
Skip all this. Go get help right now.
Yeah,
Call
exactly.
Somebody.
Still worth listening to, but...
Yeah, the world of telehealth, right? We're in the 21st century. If you talk to somebody and you can explain what's going on, people who have experience, you hear somebody go through, it's here, I'm feeling this, you can be like, oh, you almost know exactly what it is, right?
Right. It's not that there's necessarily a life or death situation here. It's just something that's going to be on the scope of what your typical personal trainer can give you advice for.
Yeah, and we don't want to just avoid stuff. That's the main thing here is don't pretend that it's not happening and try to tough your way through something of my shoulder's bugging me, but I gotta be strong. I can't, try to muscle through it, because little things become really big deals if you just try to move through stuff, right?
Yeah, absolutely. Whenever I get patients that come through the clinic, I'm also going to ask how long has that pain been going on for. If they tell me it's been going on just about a month or two, I feel pretty comfortable that we can get that resolved within a pretty reasonable amount of time. If they tell me that pain's been going on for really any more than like 3 months, a year, 5 years, then not saying that we can't help you, but it's just going to be a little bit longer process, because exactly the longer that something's been going on for, the more areas that it's going to affect, and it just takes a little bit more time to get it all sorted out. Yeah. So the sooner that you get the help that you need, just the better off you are, and the quicker you're going to be back to normal.
Action gets things done, right?
Yep.
Don't just sit there, make it happen. So if you're feeling numbness or tingling, seek help immediately. Take care of it.
Yeah.
But if you're feeling soreness, burning, tightness, shakiness, all normal stuff.
Yeah, that can just be the normal signs of muscular fatigue.
Yeah.
And like we were saying earlier, you can say, man, I felt that before, that like this is different. This just might be another level of that. So just kind of try to pause, take a minute, and think through what exactly it is that you're feeling.
Yeah, because when we're getting stronger, building endurance, you're overloading your muscle. You're asking your muscle to do more than it's ever been capable of before, right? So it's going to be challenged. It's going to be beat up, and then you have to let that muscle recover to get the benefit, right?
Yep, absolutely.
So sharpness was something you wanted to talk about too, right?
Yeah, so sharpness, I feel that sharpness can kind of sometimes go into that pinpoint pain, and so that's where we're going to talk in a few minutes about being able to modify things and going into like corrective mobility type of activities. If that sharpness kind of pain goes away with those stretching mobility exercises, then likely that might just be a tight, shortened, underused muscle. But if it's sharp, pinpoint, and it's not going away, it's pretty constant, then that can fall into this red flag category where you might want to consult with somebody else.
Boom. All right.
Well, then to me, like going off of that, like the sharpness, so then we're talking about like, when do you feel the pain? So if you have a pretty localized pain, like let's say your shoulder, like my pain is like right in the front of the shoulder, and I feel it constantly. When I wake up in the morning, when I'm eating lunch, and when I'm going to bed in the evening, it's just the same amount of pain all day long. So that's happening outside of the gym. That's abnormal, and that's another indicator that, higher up the chain, go see your primary care doctor, chiropractor, physical therapist, something to that effect.
Yeah. And at least take away the uncertainty.
Yeah,
because we've had people who are like, man, this is bugging me. Like, I know it's a serious problem. Then they go see somebody like, oh no, this is just arthritis.
Yeah, and it can be a quick fix too. Or not a quick fix, but it can be something that we can address and help it
not be a big deal. It's not saying like surgery is the thing if it's sharp. We're just saying like, take care of it before it becomes a bigger issue, right?
Yes. So when do you feel it constantly? That's where seek some advice elsewhere. Are you feeling it when you're sleeping at night? Does it keep you up at night? I can't sleep on that shoulder. That's an indicator that we might need to see somebody else. When you wake up in the morning, my shoulder hurts, but if within 30 minutes of me moving around, it feels pretty good. Then we might just need to bump into some of these corrective mobility exercises. Maybe that shoulder's tight. Maybe we've got some tight, weak, underused muscles that we just need to
like where I feel like you're working in an office job, and at the end of the day, your lower back hurts.
Yeah.
So that's just probably tightness.
Exactly.
Like you being in the same position constantly, right?
Yes, absolutely. Versus, am I feeling it just in my workout? If you're feeling it just in the workout, then that might be that muscle fatigue that we're working on with that.
So excellent. So that's kind of the 3-step process you want to think through, right? All right, what am I feeling? Where is it at? Is it pinpoint, or is it over a whole area? Right? Pinpoint, maybe it's more serious deal. Area, probably don't worry about it, right? So if you evaluate it, you identify where it's at, you describe the pain, you look at, is it numbness or tingling? If no, okay, we're solid. Is it soreness, burning, tightness? If you can think through that, like, it might just be fatigue.
Right.
And then when am I feeling it? If it's constant, if it's keeping me up at night, probably more a serious deal. If throughout the day it gets easier, or I only feel it after doing like the same repetitive exercises, then it might be it's probably a mobility.
Probably a mobility issue that can be addressed.
Yeah, and if it's in workouts, we probably have some limited mobility that we're dealing with.
Yeah.
All right. So we've identified, we've thought through it, right? And now, what do you do about it? Do you ignore it?
No.
Of course not. Don't ignore it.
We just said the longer that you ignore it for, the harder it is to get back on track once you do decide to address it. So once you've decided that something abnormal is going on, let's address it right away. So yes, we can modify. So modify being that what we don't want to happen is, let's say your shoulder's hurting you. Oh, I can't go to the gym for this week. I'm just not going to go in.
Don't stop moving.
Yeah.
keep
you
working.
can keep moving.
There's plenty of other things we can do.
Absolutely.
And there's ways that we can adjust what we were doing for our shoulders, right?
Yeah, it doesn't even have to mean that you can't do the same workout that everyone else is doing. What you can try first is adjusting the weight. So we can say lower load, higher repetition. So lower load meaning decreasing the weight. Go to like 50% of whatever weight you were just using. And maybe you do 5, 10, 15 more reps, but you are pain-free during that whole time. Perfect. So if we can find a pain-free load, meaning weight, and if we can find a pain-free range of motion. So if it's your knee that's bothering you, maybe you just don't squat down as far for a little bit and then work into increasing that depth.
Yeah.
Or if it's your shoulder, maybe you just can't press up quite as high. So 2 big things that you can modify initially are the range of motion and the load that you're using.
A point on that too is like sometimes when people say like decrease by 50%, like, well, I'm wasting my workout.
No.
Absolutely not. You get a ton of benefit out of just going through working your body through that range of motion. Not going through the motion. But continuing to work and staying active, right? Versus just stopping altogether. Huge difference.
Absolutely. And that's why we say too, like if you're going to decrease the load, then you can go higher reps. So you're still getting the same amount of work in, the same amount of effort as everyone else in. It's just that in a different, just a different way.
Yeah, different variables.
Yeah, exactly. So then another thing that we can do about it is trying to incorporate some stretching, some corrective and mobility routines.
Big deal. You need to stretch. Everybody needs to stretch, right?
Yeah, absolutely.
We have these imbalances going on just from the way that we sit, the way our computers, phones, all that stuff, right?
Everybody has different occupations, meaning everybody has different jobs that they do throughout the day. You know, whether you're someone who's watching your children throughout the day, if you're sitting at a desk job, if you're driving a truck. I mean, I've seen all of it. And everyone's going to have things that they're doing throughout the day over and over and over again. And I would say the number one cause of most injuries is overuse. So it doesn't matter what you're doing. If you're doing it 1,000 times throughout the day, likely is that you have some muscles that are being overworked and some muscles that are being underworked. And that's going to create some imbalances that we were talking about. Yeah. And that's where it's the good news is that there's ways to address it. And that's going to be with corrective mobility routines.
Yeah, so this stretching, we're not saying just generally stretching, right? You have to be trying to address the issue. So corrective exercise and mobility routines are trying to fix specific problems, getting that joint working the way it's supposed to. And something I want to touch on, what you're talking about, like overwork. Probably a lot of people are like, well, I work at a desk. I don't overwork anything. It's like you just being in the same position is working muscles, right? You're overworking like your hips, your glutes aren't doing their job. Things get out of whack.
Your upper back, your neck, your shoulders, your wrist. Yeah, it doesn't matter what you're doing, desk job, a lot of muscles are being overworked and a lot of muscles are being underworked.
And so far as these mobility routines, make sure that it's targeted, right? In this course, we have a shoulder fix, lower back fix, and a hip fix that address like normal stuff, right? If you're sitting a lot, if you drive a lot at the desk, like these are common things. You're on the computer a lot. These are common things. If you have any of those issues, do those mobility routines. If there's something else going on, like elbow pain or something, you can YouTube mobility routine for elbow pain, and you're going to find videos from physical therapists walking you through that kind of stuff, right?
Yep. There's a ton of great therapists out there who, like, I know that Dr. Joe is one that I've seen a few times.
Dr. Joe?
Yeah. It's a lady.
Whatever. So you do that corrective routine, right? You modify your stuff, you stretch it. Now, if you feel relief, excellent. Corrective exercise is immediate, meaning my quad hurts, my hip hurts. I go down, I do my hip mobility routine, I stand up, I'm like, oh wow, I feel better. Not that it's gone altogether, but if I'm 30% better, 50% better, you know, I do a couple squats and I'm like, yeah, that feels way better than it did before. That's relief. That's what I'm looking for, right?
Yep, absolutely. Yeah, so we're not looking for, you know, on a 0 to 10 point pain scale, 0 being no pain, 10 being the worst pain, like needs to go to the emergency room. Let's say you're coming in and you're doing something and you're like, man, I got probably a 5 or 6 out of 10 pain. Well, if we try a few of these things, maybe we're down to a 3 out of 10 pain. That's good. That means that we're decreasing that pain. We're on the right track. And it just means that we need to start incorporating these things daily. Yeah.
So don't look for it's either all or nothing. I'm hurt or I'm not hurt. That pain scale is a great thing to use of scale of 1 to 10, where am I at, right?
Yep. Absolutely.
Cool. And if you go through this mobility routine, it's targeted. It's working on the specific problem that you have, and you don't have any relief, don't hit your head against the wall over and over and expect a different result, right?
Yeah.
We got to go next step.
Yep.
We need extra help.
Yep. Thankfully, there's people who dedicate their lives to this kind of stuff. So
that's what you do. So yeah, if you need extra help, and again, like we're saying, a lot of problems can get solved so quickly. You see a therapist a couple times and you're like, oh my God. Like we had a client the other day, her hamstrings have been bugging her for months. She loves running. And she kept stretching, kept resting, wasn't fixing it. She met with you once, you realigned her hips, and boom, everything's all good.
Yep, we're good. And then, but the thing about that is now she knows her corrective exercises and her mobility routine that she needs to start incorporating to be able to prevent that from reoccurring.
Got the targeted approach. So what we talked about, telemedicine's everywhere, right? You can directly see physical therapists in most states, including Texas, without a doctor's referral, and they can kind of give you next steps from there, right? So see a therapist first. They're the experts on fixing your broke body. So go see them if you're
movement
broken.
And musculoskeletal experts.
That's right. If you have a coach, if you're in private training with somebody, or you have access to a coaching program like ours, talk to us, because we've probably seen similar things before, and we know next steps of like, yeah, this is something we can probably solve and give you resources, or we can tell you to go who to see, what to do next. And then of course, talk to your doctor, right? So that's the idea here, is we just don't want to, like, I start working out, I feel pain, and I'm either ignoring it or I'm getting stopped by it. Like, there's something we can do. And there's other things that we can work on. We can keep momentum on our side, right?
Yep. We don't have to stop, and we don't have to run ourselves into the ground. There's options to keep us, in the lane, in the right lane, and keep us going where we need. Yeah, there we go, on the path.
That's right.
There's options to keep us on the path without veering off and not going where we want to go. So
that's it. Taylor, thank you.
You're welcome.
Appreciate you. Hope you guys got a better understanding of how to think through the pain that you feel while you're exercising.